5 minutes of question.
Thank you, Mr. Chair. And I would think that deaths is happens to be one measurement, but permanent damage or damage of any kind to the respiratory system and cardio systems might also be another calculation that we should pay attention to. Public trust in our health agencies can be quickly eroded by political interference in public health decisions. We saw this during the pandemic. Politically motivated efforts to downplay the dangers of COVID-19 by then President Donald Trump are well documented. Reports showed that during the early stages of the pandemic, the Trump White House interfered with CDC efforts to carry out media briefings that would have provided science-based information to the public. I'm a big believer in relying on science, and I think we've rejected it in many, many occasions on the Hill. And rampant misinformation also impeded public health officials' efforts to get critical information out to the public. So, Dr. Benjamin, how does low public trust in healthcare institutions impede our ability to effectively respond to what was a public health emergency, if not continues to be?
Yeah, it creates an environment when you have low public trust that people won't do what generally is recognized by experts. And we saw that in vaccine uptake. We saw that in people taking medications that have been clearly proven not to be effective, like hydroxychloroquine. We saw that in people using all kinds of things that they would go to the internet and find and use. So it's a real problem, and it's persistent. And we're now seeing it bleed into routine childhood vaccinations, uptake in other adult vaccinations. So it's a big problem.
So the damage can spread. I don't ever remember in my many years a public health crisis becoming so politically charged. And I think that is a difficult dynamic to introduce. How does this spread of misinformation about, for instance, the safety of vaccines worsen the risk posed by an infectious disease like COVID-19?
Well, it means that people won't get vaccinated or do other protective things, and then they get infected and they infect other people. You know, in the spring of 2020, early part of the pandemic, we already had anti-vaccine groups handing out flyers going into communities and telling those communities, don't get tested, when the vaccine's available. We didn't have a vaccine yet, but before we even had a vaccine, don't get the vaccine, and all the bad things that they hypothesized would happen if you got it. So they were already on working against good public health.
Yeah, and that just creates a weak environment, especially as it relates to our children, because they're not, and many times, making those decisions. GAO has issued several recommendations to immunize HHS's operating divisions from political influence, including by developing policies and training staff in reporting bias. AHS has agreed with these recommendations and is in the process of implementing them. So, Dr. Benjamin, how do efforts to reduce political interference, how do efforts to reduce political interference strengthen CDC and improve public confidence in health institutions?
Well, quite frankly, the current administration stopped screwing around with their website, telling them what to say, interfering with their public presentations, and in all followed the science. And that has dramatically changed the way the agency has been able to function and engage with the public and engage with other partners. That was a terrible mistake that was previously done, and that will help CDC recover the trust of the American people.
Right. Well, science-based and evidence-based data and anecdotes should be what guide us. Dr. Yenigan McCauley, GAO's latest high-risk report mentions the importance of HHS building a skilled health workforce. I would argue that persistent political interference with the work of healthcare professionals would be counterproductive to achieving that goal. Why is strengthening the healthcare workforce a key component to public health emergency preparedness?
It's absolutely essential. No matter how many systems you build, or you have to have the people to be able to run it. I mean, obviously, we're getting artificial intelligence and we're getting smarter and being able to do things without staff, but that's not where we are. And as we've said on this committee, or on this board right here today, on your panel, it takes the whole of nation. It's patchwork, and it's from at the local level, tribal, territorial. It's everyone.
Mm-hmm. Okay, well, my time has now been exhausted, but I would say it's important for us to pay attention to and listen to science so that we can do the appropriate policy.